Good morning, everyone. It is Thursday, December 23rd, but we aren't actually here again today. We have recorded this introduction to one of our very favorite episodes for you to enjoy while we are out spending time with our families. You know what tomorrow is, right? Yep, it's Christmas Eve when Santa makes his annual round-the-world visit delivering presents.
But a year ago, COVID was causing even Santa to do things differently. We have to treat Santa right? You're about to see one of our favorite episodes from this day last year when Santa let us into his workshop.
That's right. He let everyone know about the adjustments he and his elves made to be safe. That included socially distanced workstations and masks for everyone. He also had to get creative when he visited the children, showing pictures of some of those safe visits.
Santa promises again this year that everyone at the North Pole is safe and vows the pandemic won't keep him from delivering toys around the world on Christmas Eve.
So while we're at home getting ready for his visit, we hope you will enjoy this encore presentation. And of course, we will be back with you live Monday, January 3rd.
I'll be home for Christmas with my mask and vax. We'll stay safe. I don't want to know the rest of the line. I'll have to work on that. Sorry.
Can I just tell him happy holidays?
Yeah, that's good.
Happy holidays.
Good morning, this is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio with my good friend, Dr. Dana Hawkinson, Hawkeye, Medical Director of Infection Prevention and Control. And we have on our best ugly Christmas sweaters because we want to celebrate the season with you. Hawkeye, you look... marvelous.
Yeah. It's the reindeer.
Reindeer. I have my resting Grinch face. How does that go by? That's pretty good, huh? Not bad.
Yeah, we can't see it too much with the masks on anymore, but...
I know. But this is pretty good because, this is kind of the Scrooge Christmas with the coronavirus and all that. Mm-hmm. But I tell you, that reindeer going right up to the mic, that's pretty special, man.
Yeah.
Did you make your sweater?
I bought it.
So my sweater was made by the nursing staff on Unit 15, which is our cystic fibrosis ward. They had a competition a few years ago to raise money, so they sold some Christmas sweaters, and I tried to find the worst one I could get, and then win the ugly Christmas sweater contest,
I like it.
Which I won. Shocker! But thanks to the nurses back on Unit 15. Hawkeye, how are we doing today?
Yeah, we're doing okay. Again, we aren't in the hundreds where we were a couple weeks ago, so that's good. 73 acute inpatients with 28 in the ICU, which is a smaller number. That's a better proportion than we've had. Unfortunately, a large proportion of those are on the ventilator. 20 out of 28 patients are on the ventilator. We still do have 66 patients who are in that kind of recovery period after that acute infection, and 10 of those are on the ventilator as well. So again, we've talked about how long, if you get on the vent, there's a good chance you could be on the vent for some long amount of time, and that is certainly true here. Hayes is a little bit better, though, 23 patients with 18 of those active and 5 in that recovery period. So I think, it's not as good as we would like. We would like 0. We would like even to be down to the 30s where we were before, but certainly better than we thought we would be a couple weeks ago.
So it would be so critical to watch what happens over the holiday season because we know that's where the next pressure is going to come. People are gathering, and there's a higher prevalence rate already in the community than there was before Thanksgiving. And because of that, the chance for spreading within the community grows as people congregate around Christmas. So Kansas City, BKC. Remember to follow the rules of infection prevention and control. Wear your mask, keep your distance, wash your hands, cough into your elbow, don't go outside if you're sick, and there's still no place like home. You might hear that again at the end of the program today. Mm-hmm. All right, so I am really excited about our guest today. We are 2 days from Christmas, and our guests have some thoughtful advice on how to help us stay safe and reset for 2021. We will talk with Joan Wells, the CEO and co-founder of Wellington, on what that means to her. And Santa Claus, I love your mask. Wow. I love the whole outfit there. That looks awesome there. And he is with us today with a few words about what he's watching this year on his naughty and nice list. So that'll be awesome. Let's first see if there are any reporter questions out there.
Good morning, guys. Taylor from Channel 41. How are you this morning?
Taylor, Merry Christmas to you if I don't talk to you before then.
Absolutely. To you too, sir. A couple of questions this morning, one from a viewer and one from me. I'll start with the viewer first. She says she's been struggling with her sons about getting the vaccine because both say they will not get it because they don't know about long-term effects. Mm-hmm. You guys have obviously talked a lot about this, but what's your current pitch to people right now who are saying they don't want to get it because they don't know enough about it to convince them to get the vaccine.
All right, Hawkeye, let's go through this. I'll start. I'm going to kick it to you, but I'm going to take the easy points. All right, so the first part, society with COVID, society without COVID, okay? How do you get to society without COVID? You have to have vaccinations, which give us herd immunity. Here we are with society with COVID. You got masks, you got distancing, you don't have any crowds in the Royals and Chiefs game, and let's be honest, we are all missing the Chiefs games right now as we head into the playoffs. And I want to be there for opening day. It's going to be tough. So society with COVID, we know what it looks like right now, and we remember what it looked like without COVID. How do you get there? You get there by having so many people vaccinated, the risk of viral transmission drops dramatically. And the risk of bad outcomes from the virus dropped dramatically. So for just the sheer fact of public health and getting life back to normal, keeping our businesses open, having the economy run, you want to be over here and you want to be vaccinated so you can get there. Now, let's address whether or not vaccines are safe, or are we just trying to give you some terrible thing? Well, we're definitely not trying to give you terrible things. That's not what we do. No. You and I would get the vaccine right now if it was offered to us. We haven't gotten it yet. It's not my turn here in the health system. It's not been your turn. Your turn's going to come probably before my turn. Yeah. But I'll tell you what, as soon as I'm eligible, I would love to get it. I'll take videos or pictures of it or try and get it right here. I don't know. We'll make sure y'all know that we've gotten it because I think we both feel really comfortable. The other thing we remember is a few weeks ago we had the director of vaccine research at Mayo Clinic on, and he made the really great point that when people have side effects and problems from vaccination, it happens within the first 2 to 4 weeks. And certainly by 6 weeks, 99.9% of problems from vaccines emerge in that time frame. Now, the FDA waited and made sure that Moderna and Pfizer tracked their vaccines for 8 weeks and continued to do so after that, but they wouldn't approve them until they had 8 weeks worth of data showing that there were very few side effects. And Dana, that's exactly what they found. Very few side effects.
Yep. You know, you kind of beat me to the punch. I was exactly going to talk about Dr. Pollan as well. Such a a great voice. But that's true, as far as long-term effects, there's really no signal even that there will be long-term effects. The RNA that is injected into your body from the Pfizer and Moderna vaccines will be degraded just as RNA is every day in our cells. As far as the other lipid nanoparticles, those will be dispersed as well. So there's no evidence or signals of any lasting long-term effects. It's really within that first 2 weeks and, as you heard Dr. Pollan say, even out to that 6 weeks. But really after that, there's really no evidence of having lasting or long-term effects.
You know who we should trust in this one, Hawkeye? Dr. Fauci.
The best doctor in the land?
I think so. Okay. And so you and I, we got a gift last night. I think Santa, thank you for this, early on, an early Christmas gift. I have an Anthony Fauci hat. I look marvelous with an ugly Christmas sweater and an Anthony Fauci hat, right? This is the best. You know what it says? What's it got? Fauci on the front. You know what it says on the back? Wash your hands. So can you think of a better gift than an Anthony Fauci hat? And he put a little note in it when he sent it. He said, I want to thank you and Hawk for doing all this great work here in the Midwest where the virus has been a little rampant at times. Keep up the good work. Let's keep everybody safe. I mean,
it definitely classes up the show.
Sure. I think it really does. I think it classes up the sweater, but that may be setting a low bar. Right. So I just want to say thank you, Santa, and thanks for my Fauci hat. I will wear it in good health, keeping socially distanced, wearing my mask, and doing all the things I'm supposed to do, including washing my hands. Remember, folks out there, Fauci is the man. Listen to the man.
Absolutely.
All right. Other questions? Taylor, you had a follow-up.
I had a second viewer question.
Yes, sir.
Yeah, well, I just got a second viewer question, too, that I want to ask. It's a little bit more complicated. I'm just going to read it to you directly. I have a memory care family member that has tested positive for COVID last Tuesday while in rehab. The only symptom was body aches and slow cognition. The rehab will not retest to see if she becomes negative, stating they are following CDC guidelines, but they're encouraging us to bring her home with us when she's ready for discharge in the next few days. Because the rehab will not retest, how can my husband and I know we will be safe bringing her home and being in close contact caring for her?
Yeah, great question, Hawk.
Yeah, we've really gone away from the retesting after a positive test. That was done, in late spring or early summer, going away from that retesting. If you have a positive PCR, you're positive. Right now, there is no reason to retest in those patients, especially if you're not ill and going, if you're not otherwise immunocompromised, if you really otherwise don't seek medical attention. You really go through the symptom-based reasons for getting out of isolation or getting back into society, and that is really 10 days from the symptom onset or the diagnostic date when the test was done. After that, you don't need to get a repeat test, just because we know that you can shed parts of the genome for up to several weeks after that initial infection. So there is no reason to retest, especially in this case, if we're talking specifics. Make sure that it's just really 10 days after the symptom onset or the diagnostic test, whichever one you would like to use. And after that, you can be safe to get back into society or get back with your loved one. You know, you can always consider doing an abundance of caution and wearing masks in the household and still trying to distance as much as possible. But really, it's that 10-day mark, especially for people with mild or no symptoms of infection. They really should clear the virus. Their immune system should clear the virus after that 10 days.
Yeah, so it should be safe to bring them home, I think.
Absolutely.
And another test probably isn't going to really change that.
Yep.
All right. Other questions that are out there from reporters.
Yeah, hi, this is Ellen McNamara from KCTV5.
Hey, Ellen.
Mm-hmm.
Yeah, so I was just reading something that USA Today put out, and a panel had said, quote, that the U.S. has nailed the science behind the COVID vaccine. You know, next up is going to be kind of logistics and trust. Have you guys, first off, I mean, you kind of hinted just about, you know, you talked about kind of what Dr. Poland had said earlier, and, you know, that there aren't these long-term effects, and that obviously is a positive thing. Can you just talk about just kind of how positive maybe this has been, and, you know, I guess the U.S. just finalized a deal with Pfizer for 200 million more doses. Have you guys been surprised with just maybe the lack of problems so far? I mean, yes, there are going to be hiccups, but right now things seem to be going pretty well right now as far as the vaccine goes.
Yeah. So I have 3 words for this. Jet, chip, wasp.
Yeah.
Because you think about, is this like a magnificent home run or a clutch pass at the end of the Super Bowl? Yes. This vaccine is remarkable, and it's remarkable because of its 95% infectivity rate. If you look at the patients who got hospitalized out of the 30,000 folks in the Pfizer trial and the 30,000 plus in the Moderna trial, Hawkeyes, I remember there are like, if you put the 2 trials together, like 300 people got hospitalized, and only one of those people who got hospitalized was in the vaccine group. The other 299 or whatever the number it was were all in the placebo groups. This works. You want life back to normal? You got to get a vaccine. The way to get a vaccine, you got to wait our turn. You make sure our production's ramped up and get vaccine distribution out to everyone in all of our communities without regard to race, religion, color, income, whatever. We need everybody to have this vaccine. And you and I are going to line up as soon as it's our turn to get that vaccine.
Yeah.
We believe that it is really safe because, you know, vaccines have been safe for the longest time. We know that really there are people who are, let's get our vaccine. Then there are the vaccine hesitant groups. That's people who are thinking, you know, I'm not sure yet. I want to watch a little longer. We kind of heard one of the questions from Taylor's viewer about that. And then there are the vaccine deniers who are just the anti-vaxxers, and they're saying, I'm never going to get a vaccine. You know what? Okay, but just remember that COVID is a deadly disease, and you are putting yourself and those who you care for, if you have children who you don't get vaccinated, you're putting a lot of people at risk. So, okay, that's your choice, but man, the way to get back to normal is to get a vaccine. It really is the jet, chip, wasp of vaccines.
Yeah, no, I would agree. I think, you know, this vaccine, from the data that we've seen in protecting against disease and especially protecting against severe disease, is remarkable. We have to remember the quickest vaccine that has been brought to market was about 4 years for measles vaccine, I believe. We have still been trying to get an HIV vaccine, an RSV vaccine. We've been trying to get a universal influenza vaccine so that we don't have to vaccinate every year, but we have protection from a component that doesn't really change on the influenza virus. So we have protection much like we do when we get a once every 10-year tetanus vaccine, things like that. So I think the speed with which we have developed this safe and efficacious vaccines, and again, right now we're really focusing on Pfizer and Moderna because those have the EUA, is absolutely remarkable. But also remember that it's not brand new technology. The technology has been worked on. They have worked on this technology with other viruses. So we are standing on the shoulders of that previous work for the last decade or more. But overall, yeah, I think that we can say that science is remarkable right now, and the pace with which we have gotten here is absolutely remarkable as well.
And we want to thank those people who have worked so hard on it. I mean, Operation Warp Speed has been successful, and not just because it's a phrase borrowed from Star Trek. It's successful because it's been a great operation, and we need to be thankful for that, for how fast that's moved, and for the great scientists at Pfizer and BioNTech. I mean, this is remarkable work, but they really stand on the shoulders of many people that have come before them who have helped to develop this technology. And remember, the messenger RNA technology was originally developed for SARS-CoV-1 and the MERS virus. So, I mean, it's not new technology, actually. It's been out there for 8 years or 10 years.
And, you know, they've been looking at other viruses, CMV, which is a common virus, which most of us harbor in our body anyways. So a lot of different viruses they've worked on this technology with, absolutely.
All right. Any other reporter questions? Let's jump to our listeners. But first, before we do that, let's talk again to Joan Wells, the CEO and co-founder of Wellington. Joan, welcome to our update. You wrote an article. Hey, you wrote an article for the Greater Kansas City Chamber of Commerce that sparked attention because of the thoughtful advice around reconnecting with our socially distanced and estranged friends and family. That's really important, I think, right now here in our holiday season. Tell us a little bit about what you do and what inspired you to write that article.
Yeah. Well, so we're in the business of creating human connections, everything from live events, virtual experiences, digital experiences, gifting experiences, but really the core of that is live gathering, people connecting, building relationships, and especially this time of year, think how important that is. It's your bucket usually gets this huge refill in December, and it's corporate holiday gatherings or your family big holiday gatherings and friends, and the whole world is cruising through this time without their bucket being replenished, and kind of that feeling, that reset that you normally get this time of year to launch and propel you into the next year. So what we're seeing is a lot of empty buckets right now, and the necessity to create and design alternative experiences that really help people feel more connected, less isolated, and kind of more emotionally prepared. Now we're sort of, now the vaccine's here and we see hope on the horizon.
Yeah, that hope is a powerful thing. Sometimes it's the only thing. What is the impact of not being able to gather as we traditionally have, do you think, or over the holidays?
Yeah, I think it's really a need for people to take some time to not just think, oh, I hopped on a Zoom call with my family, or we had we're going to do a big corporate virtual meeting launch in January, and that'll be good, that'll fill the bucket. Really, it's taking some time to thoughtfully design those experiences. When you think about it, we've all participated in terribly awkward, brutal Zoom calls where you are, no one knows what to say, and it feels very stilted. And it's really difficult to start and build relationships in that environment. So it's really taking the time to create unique and fun experiences, giving everybody a role as part of a virtual experience, taking time to initiate deep and meaningful conversations. So whether you're on a Zoom call with your family or you are on a corporate meeting, have little digital conversation cards, deep and meaningful questions that you're asking each other. Break off into smaller groups so you can have more intimate conversation and relationship building, so that these alternative experiences that people are having right now don't enhance your isolation, but really bring you closer together.
Indeed. And those how do we take what is special about our holidays and our traditions and things like that, translating them into this new COVID world?
Yeah. What's interesting, it's like you start with really analyzing what is special about this live experience normally. Is it that I'm going to encounter and meet new people? Is it that I'm going to be able to witness and experience amazing entertainment? Is there a group competition aspect of it? Whatever it is, you need to translate that in a different way, in a virtual way, for example. It's even possible virtually to do networking, like you're at a cocktail reception. You send people, cocktail kits in advance. There's virtual experiences where you are popping into networking chat rooms and having conversations with people and popping out into others. And so that was something similar we did for the Kansas City Chamber of Commerce this year, because that's what's really important to them, is ensuring that their guests are, which are really people who are super involved in Kansas City, are connected to one another. And so there's a lot of that where you can take what's special about the live experience and ensure that you are achieving that in a different way. Or, for example, we took a Fortune 500 company, 80,000 employees, and typically, they would have live experiences this time of year. The CEO would feel, an executive team would feel like everyone was touched in some way at these live gatherings. And then this year, they instead gave people the power of choice. When you think about what a powerless year people have had, we created a website for them where they could select 51 gifts, the one that spoke to them the most. And all 80,000 people received a gift from the CEO, just kind of telling them how important they were to the company, that they're appreciated, they're seen, they're heard. And that's really vital at this time of year, to really think about what is it we're doing to refill people's buckets at this very important time.
Yeah, those are great. So talk to us, where can people go to learn more about Wellington's ideas to reset in 2021?
Yeah, would love everyone to visit wellingtonexperience.com. And it would be great we'd be happy to brainstorm with you. And we're super excited for 2021. This has been an amazing year. There's a lot of blessings from COVID. And one is companies have had, and people personally have had the ability to innovate and adapt and really dig deep and kind of form even deeper connections and bonds that will be lasting.
Yeah, indeed, that's true. One of the things, though, that is a lasting bond is my relationship with Santa Claus. Because since I was a young child, I have loved Christmas. It's been like my favorite holiday, and I love to give gifts and have fun and go out and feel like, each of us could be Santa and spread a little joy in the world. Santa, how has COVID-19 changed your work and the work your elves do every year?
It has changed us quite a bit. I mean, the appearances that Santa's been making, people have gotten creative, how to keep social distancing. And the elves, they're staying busy, keeping their face mask on, hand sanitizers, and partitions between each elf workshop. So it has been challenging, but we've survived and making do. We're getting out and seeing all the good children and stuff still, and making appearances here and there. Outside, if it's going to be inside, everybody's got a face mask on. We're staying social distancing. That's a beautiful picture. We did one in Lee Summit. He's sitting back on the bench. The kid's standing about 6 feet in front of me. Here's another one down in South. The kids were behind trees, or they could stand about 6 feet in front of me sitting there. We got creative. And here's another picture of Santa on a porch down in Greenwood. We was handing out, or they was picking up gingerbread house kits. So, they'd have their face mask on. Here's a picture of Sophie, who's got leukemia. And, of course, Santa cannot even get close to her. And we had a great visit, me and her sister and her, and being able to talk. And there should be one more picture. I don't know if it's there yet. Yeah, there it is. We had a tin can conversation. It was awesome. This little girl always went to Bass Pro Shop to see Santa, and she was disheartened this year that she couldn't go. And so we got to see her this year, and it made her night. So that's just some of the things we're doing. Yeah.
That is great stuff, Santa. And by the way, you rocked those sunglasses. That was a good look for you.
Thank you.
That was awesome. And I'm glad you're working so hard to stay healthy, and you got some great job at how you've been hearing Christmas wishes, and that special story you just shared. That's awesome. Now, you've been an avid mask wearer throughout this pandemic. Do you think that's been helpful in spreading the good message that Dr. Fauci would have us spread? Right there.
Yes, I think very much. And the face mask I am wearing has been made by my elves, especially for me. It is a screen print of my face. And so a lot of times people say, well, you need to put your face mask on. Look at my lips. They're not moving. So
that is perfect. I love that screen print. Where'd you get that mask? Because you said the elves make it. Are those available to anybody else? Because that's pretty cool.
There is a website that does, they can take a picture and make a screen print of it. Yes.
That's pretty cool. I'm sure they're working with your shop to make sure those get distributed.
Oh, yes.
Yeah, we hear that mask wearing help folks stay on the list of who's naughty and who's nice. How did you differentiate that? How did you use that list this year?
It's been tough. I have the elves sitting around on the shelf, keep an eye on the kids and washing their hands and make sure when they're going out, they're wearing their mask. And I just make sure, I don't tell them, get them on the naughty list for not doing it. I said, just be careful and make sure you do and remember, try to do it. So.
Yeah, that's a really important thing. Where did Hawkeye end up on the list? Is he naughty or nice this year? What do you think? I'll help you if you need any insight.
I've been checking the naughty list, and unfortunately, Hawkeye, I can't find you on the naughty list.
Oh,
we've
man,
been
you're
in
so
lockdown.
nice, Santa.
We've been in lockdown. There's no way I could be. Maybe 2021. We'll see what happens.
Yeah, well, let's not talk about 2021 when people are safe. That list could get a little longer. Hey, there was a question as we turned. Thank you. I'll stay on for a little bit. We're going to go to some questions from the community for a few minutes before we come back. And by the way, I just want to say, as we head into the holidays, before I forget right now, we all have a lot to be thankful for. I want to shout out to our team here today. And guys, before we finish, is it possible for you to come out from behind there and run up and just kind of wave to everybody here on the camera? All right, let's do that. Let's go. Come on, roll on out here. A couple of thank yous out here. Come on, Logan, Anthony. Jill's not here today. She's having a few days off, but we'll say thanks to her. First of all, Anthony. Anthony is the gentleman who got married. Anthony's also a COVID survivor, so thank you, brother. You've done great work. So glad you're here with us. Logan, get up here. Logan is one of our, these guys work behind there every day. They do a great job. They're even-tempered, and even when I walk in here at the last minute, they call me a prima donna when I do that. Well, when I walk in at the last minute, it's like they are ready, and they take care of us. Jess, come on out here. You got to come. Let's get shown. Everybody, come on.
She is naughty, by the way.
Yeah, there you go. Look at her great Christmas vest. There you go. You look great. I don't know. That's pretty tough. All right, come on up here. You got it. Come wave to everybody. Say hello. All right, there we go. We got everybody. I want to say a special shout out. These guys work hard all day long. Cliff's not here. I should call out Cliff too, and everybody who helps put this program together. We've been at this for approximately a very long time. I think you and I signed up for like a couple of weeks when we first thought this was going to happen, and here we are. And maybe someday soon they won't need us anymore because COVID will be cured. That'll be the best thing. Hey, one of the questions that we wanted to start out with, we got a question about whether or not there are any fetal parts in the development of this vaccine, because some people are very uncomfortable with that, and whether or not you should be vaccinated. And that's an important question. And I think you mentioned even that Rome has even had some guidance around the vaccine.
Yeah, absolutely. So, there were some aborted fetal cells or cell lines from decades ago. So it is far removed from where we are today. The U.S. Conference of Catholic Bishops has spoken on this. The Vatican has spoken on this. And they do not see any moral problems with getting the vaccine. They actually feel that if you do not get the vaccine, though, it is your moral obligation to continue to mask and do those things that we've talked about. But as far as people worried about aborted fetal cells in tissue, certainly from the Catholic standpoint, from the Vatican, from the U.S. Conference of Catholic Bishops, there is no moral blocks to that. There is nothing wrong with getting the vaccine at this point in time. So hopefully that will allay some people's fears. A lot of problems or issues come with people and their stance and their feelings on abortion. Certainly we know in the Catholic faith that abortion is no and right to life. And so I think a lot of those concerns or questions may come from that standpoint, but just understand that the Vatican, Rome, the U.S. Conference of Catholic Bishops has said and given their blessing to get the vaccine at this point.
And you're of Catholic faith, so that's a key issue for you.
Yeah, absolutely.
All right, Jess, I know we've kind of used a lot of time, but let's get into the questions we can have from our audience.
Okay, so let's get a few in here. So Sherry says, you mentioned the vaccine is not known yet to prevent transmission, but it's confusing for the layman. Doesn't the vaccine prevent you from getting it? Can you please explain?
That's a great question.
Good question.
Go for it.
Yeah, good. Getting kind of into the details. So the vaccine, the best thing to remember is from what we have and the efficacy data, it really protects you from getting the disease. And the disease is all the symptoms that we've heard about. It also is very efficacious at protecting you from getting severe disease, meaning having to go to the ICU, being put on the ventilator. does it prevent you from infection? If you are around somebody who has it and you are exposed, you certainly can still get infection. Your body can take up the virus. You can start replicating the virus. But will you get disease from that infection? So those are the two important things to remember. Now, will it help stop transmission? We don't know. Certainly, I think there was some early signals from the Moderna studies, but we don't know that for sure. We would hope that it would help reduce transmission, but we just don't know that for sure. So I think that is the important thing to remember about you can still get infected, you can have replication, but since you have that immunity built up due to the vaccine, it may protect you or should protect you from getting disease, and especially severe disease, but it may not block replication fully or in the immediate time frame where you can still have viral reproduction and still have high viral titers, especially in your upper respiratory tract, where you can still possibly spread the disease and the infection.
Emily asks, is the vaccine recommended for patients with autoimmune disease?
Boy, I think, Hawkeye, that's actually a great group to have the vaccine because it's been shown to be safe so well. And those patients are especially at risk for COVID-19 and potentially some more difficult outcomes.
Yeah, this is important for immunosuppressed or immunocompromised patients. There is no contraindication to getting these vaccines, Pfizer and Moderna, unless you have a contraindication to getting vaccination in general. And you and your providers would know that. That means you haven't been able to get influenza vaccine or any of the other vaccines. So in general, yes, you can still get the COVID-19 vaccines. Just remember, if your immunosuppression is high enough or if it's great enough, you need to talk with your physician, because the question then would be, will the vaccine actually cause a protection? Will it give you immunity? And that's something that your provider would know based on what your immunosuppression is.
So Deb wants to know, Dr. Hawkinson, when you say in recovery, what does that mean when you're talking about the numbers?
In recovery basically means that if you've come to the hospital and you are within 10 days of your symptom onset or your diagnosis, you are still in that active phase of infection. If you are severely ill and go to the ICU, for instance, and get intubated, again, it's from when your symptoms started, or really in the hospital, what we're using is your test date, because it's an objective date that we can identify. And for severe illness, we say 20 days from your test date. And for just other mild to moderate illness, if you're on the floors, not in the ICU, we would say 10 days, the same as the direction and the guidance for getting out of isolation if you never had to go to the hospital after your diagnosis. So it's that 10 days for mild to moderate if you don't have to go to the ICU. If you have severe or critical illness and go to the ICU, then it's 20 days. And that is all consistent with the CDC guidance. And that is why we say that acute infection. So anybody with that acute infection have had the disease for 10 days or less, or if you go to the ICU, 20 days or less. But in that recovery, it's after those dates.
I know we talk about this daily, but this has already come up 3 times today. What are your thoughts on people who are pregnant, early in their pregnancy, or going to become pregnant, getting the vaccine?
So we've been able to converse with Dr. Alt, our our infectious OBGYN infectious disease physician, who's on the advisory panel. And I know that he's made it very clear that you should go ahead and get the vaccine.
Yeah, absolutely. So pregnant or lactating or breastfeeding women, if you are in those groups that are going to be offered, so if you are working in the ED, if you're working in the COVID unit, the ICU, anything that you're doing where you should be offered that vaccine right now in this first wave, then you should be offered that vaccine. And that is the stance of the of ACIP, who makes those recommendations. So you should still be able to get it. You should be offered it and should get it. You know, if there's really other specific questions that you have about your own health and specifics we may not know, certainly talk to your OB-GYN, but I would suspect that most OBs are recommending that their patients do get it.
Will this vaccine require 2 shots every year, or will it be a booster every year after? And if there is 2 shots, will you be concerned that people will not show up to get that second shot?
Well, you know, that is a big deal. It's interesting. If you look at how we had a chief medical officer call yesterday, about 30% of people who've been offered the vaccine citywide, really, with healthcare workers, are turning it down. And that's just a rough statistic, folks. But the point is that they didn't turn it down. They're actually part of that vaccine hesitant group. And they wanted to wait and see how people do. one of the most important things for how we do and how much better we can be, though, is to make sure you get both shots, because you need the first dose, and then you need the booster dose. It appears that the first dose of Pfizer will give you 60 to 80% protection, but 60% isn't really where you want to be. That's kind of what influenza is like. 95% protection is what help us eradicate this virus, and the way to achieve that is to take that booster shot. So it's really critical you get both shots. I know some people want to wait and see how folks do with it. I'll just tell you, our experience so far has been outstanding. We've not had significant problems. We've given it to, I think, over 400 people now. Isn't that the number today, or 500? We've done a lot.
Yeah, we've done a lot.
And I think that what we're seeing is that people are tolerating the vaccine. The shot's going in well. The side effects haven't been severe. Side effects tend to be worse after the second shot that you get, but even so, it's no worse than having the influenza shot. So I really think it's safe. We really think it's a good thing to do. We need to make sure people get both shots, though.
Yeah, right now, certainly we need to make sure you get that second dose. We do expect that you will need to get a booster in a year, kind of like influenza vaccine, but we don't know that for sure. We still need to do the studies, but again, the vaccines have just come out, so we don't have any data about the durability of those. Certainly, we would expect the durability of just one vaccine on that initial dose probably will have less durability, meaning it will last shorter or not as long as if you get those two doses. Right now, I think most experts are expecting to need to get booster dose, but once you do that, it's really unclear. Will you need one or two like that first initial set as well? And we just don't have the data or the guidance right now, but I'm sure that will be coming out as we get further into this and more vaccines have been rolled out.
So we have a couple more questions.
Okay.
Jenny asks, when should someone who has had COVID be vaccinated?
We've been saying at least, you could probably wait 90 days after the time you've had COVID,
Yep.
because we know that you have good antibodies for that time period. After that, think about getting it. Now, it's not really available much to the public, because it's going to commit to healthcare workers and frontline workers, essential personnel like firemen and police and first responders and essential workers into nursing homes. And then it'll be going out to the general public. And the guidance from the CDC is that those over 74 years old get the vaccines first and before you start going to the next level. So I think, hopefully sometime in the next month we'll have enough vaccine we can really get into that. I know some places, the Kansas City VA was thinking about trying to start introducing it to those who are over 74 very soon, maybe before they even finish doing some healthcare workers. And I think that that's a reasonable choice, because there are some people who have more exposure and some people don't. So I think all of that is a way of saying we are, remember what Jessica Calendar-Rich used to say, we are building the airplane while we fly it, or in Santa's case, we're building the sleigh while we guide it. And in doing that, we'll make sure we get it to everybody.
Can you address the safety of the vaccine and cancer patients?
Yeah, I think Hawkeye, it's safe, and we need them to get it, because they're some of the most at-risk patients. And I know our cancer program is really anxious to start being able to give the vaccine to cancer patients.
Yeah, well said. Nothing to add.
All right. Well, let's go ahead and we'll wrap up today. A couple of words. We're off the next couple of days on Christmas Eve and Christmas Day. We are back on Monday, and we'll return with Vibrant CEO Patrick Salee, who has an update on how Vibrant, as a federally qualified health center, is working in the community to help spread the word about vaccines and masks to help us stop the spread of the virus. Let's first talk back to our CEO of Wellington. Joan, final thoughts today as we wrap up.
I think to look forward to 2021, be intentional heading into the year, and make big plans. I think it'll be possible.
All right. And Santa, what do we got?
I just want everybody to be safe and to have a healthy Merry Christmas, and keep wearing those masks and washing your hands and social distancing.
Love it, Santa. Thanks. Hawkeye?
Yeah, I mean, to Joan's point earlier, 2020 hasn't been good, but there are silver linings. There have been a lot of innovations in multiple aspects in our lives. Hopefully, when the stay-at-home orders came, we were connecting more with our families, being together. Certainly for science and technology, we know that there has been silver linings and the fast pace of movement there, and then for other businesses as well. So there have been silver linings, although, in general, it's been tough, but we have to keep our eye on those positive things moving forward, and hopefully through 2021, once we get there, we'll continue to see the positivity and optimism, and hopefully more vaccinations.
this is a special time of the year, and I love holidays. I love trying to be Santa Claus and things like that. But it's also a challenging time of the year for many folks in our communities who aren't connected as well, and maybe don't have quite the same social fabric and social circle. If you know someone like that, take a moment and reach out and make sure that they know that they're loved and cared for. I want to say a special thank you again to our team here. Jill Chadwick's not here, but she's really kind of the captain of the ship, and she's off this week, so a special shout out to Jill and to all the folks who helped make this program possible. We want to thank you all of our listeners who hopefully hear our message and maybe help spread that gospel a little bit every day about keeping your distance, wearing a mask, washing your hands, don't go out if you're sick, cough into your elbow, all those things you've been hearing us say for approximately a very long time now. I want to be thankful for Anthony Fauci, who, by the way, makes a great hat, but also has helped guide us through this crisis by being truthful and honest. We've tried to do that right here on this program, and come next week after Christmas, we'll be back at it. And we're going to start talking about what a new year looks like and how different it can be if we can all stay safe, get our vaccines, and take care of each other. So we leave you with this Christmas wish. We hope that you experience the same love and affection through Christmas and feel that love and affection every day as we all do here from our patients, the team, and the great folks that we get to work with. Thank you for being a part of our program. Have a Merry Christmas, a Happy Holiday. We'll see you on Monday. And in the meantime, we have a special parting gift. This parting gift is given to us by Doctor's Notes. The Doctor's Notes is an a cappella group comprised entirely of dedicated medical students who put some fun into their busy lives. And by the way, they can sing too, much better than I can. So we are delighted to end our program today with their version of Carol of the Bells. Have a Merry Christmas, everyone. We'll see you on Monday. In the meantime, let's spread a little cheer.
And on without end with joyful tone. Ding dong, ding dong.